So if I can get your attention, please. We're at time, so we will get going. We have a very busy program, a lot of good presentations coming. So we will be going. So I'm Commander Sylvain Grenier. I'm the President of the Military and Emergency Pharmacy Section, and I'll be co-chair today for this session with Ms. Jane Dawson as well. In terms of a little bit of logistics, the program you can see here, the same as what you saw in the program with our 3 speakers. In the logistics, we've reviewed the conflict of interest of all the speakers, and none of them have any conflict of interest that were declared. If there are any questions in the presentation, in your booklet, you have the yes and no that you can be using. In terms of PowerPoint slide, we are asking that there's no recording of the presentation and that the slides will be made available on the 1st of October as a PDF format, and they will be emailed. Then there's going to be email links available for those slides. If you want to tweet or share, are the hashtags that can be used. And then again, if you do have cell phone, please put them on silence mode. At the end, please bring all your rubbish with you so that we can keep the room clean. Small publicity here to come and visit the FIP booth and learn more about the FIP and its programs. And of course, it's World Pharmacist Week. So in terms of introduction for this presentation, we all know that pharmacists play a crucial role in humanitarian crisis. There's more and more of those crises happening. So this session will delve into the pharmacy response in such situation, linking issues such as antimicrobial resistance, vaccination challenges, and more. We'll explore real-world experiences from recent crises in Ukraine, Turkey, Syria, and Australia, and learn how the evolution of our program since the FIP Congress of last year in Seville, where FIP made the commitment on the humanitarian front. So with this, I'll let Ms. Jane Dawson introduce the first speaker.
Good morning, everybody, and welcome to the second day of hard work. It's my great pleasure to introduce our first speaker today, who is Eiko Kobayashi. Eiko has been working with the Japanese Red Cross Medical Center after receiving a Master of Science degree in 2001 from Tokyo University of Pharmacy and Life Sciences in Japan. Since 2022, she has been a researcher at the Humanitarian Technology Unit of the Disaster Management Research Institute, affiliated with the Japanese Red Cross College of Nursing, and that's a mouthful. She has experiences in domestic and international disaster response activities, and since 2004, such as earthquake, cholera, and refugee relief operations. She also belongs to the International Medical Relief Department and is responsible for all professional and technical aspects of pharmaceutical practice in the Japanese Red Cross International Medical Relief activities. Extremely responsible job. She has organised educational and training programs for the disaster relief pharmacist role and the medical logistician since 2012. She will be presenting today on the challenges of working with the local medical team in Syria. Eiko.
Thank you for the kind introduction, Jen. And thank you for all. I'm very glad to speak in front of you today. So my title is Challenges of Working with Local Medical Team in Syria. I have no conflict COI to disclose. The Syrian crisis enters 12th years, and more than 50 million people are in need of humanitarian assistance. Turkey-Syria earthquake hit north part of Syria in February 2023, and was estimated 6.5 million people have been affected. In response to this disaster in crisis, the IFRC International Federation Red Cross and Red Crescent operated a multinational health ERU, Emergency Response Unit, with 3 mobile medical vehicles. So we're slightly affected but overpopulated northwestern Syria, Latakia, along the Mediterranean Sea. When we deployed to support capacity building of the local medical team in the Syrian Arab Red Crescent. How and what? 3 mobile medical vehicles were designed to provide NCD, chronic disease control, infectious disease, and maternal neonatal health, and hand over to the local team within 4 months. So 10 international relief workers from Finnish Red Cross, German Red Cross, Canadian Red Cross, and Japanese Red Cross, and worked with 25 local Red Crescent mobile medical teams. Syrian Arab Red Crescent has been worked for 3 hospitals and 40 medical posts in Syria, supported by the International Red Cross Network. Since 3 months of the earthquake, local mobile health team and clinics has provided the medical care about 200,000 people and 450,000 cases in total. The ERU aimed to provide comprehensive and emergency primary health care by utilizing the competencies of various professionals, including pharmacists. As most of the national team members were newly hired and had no experience in emergency situations and the Red Cross and Red Crescent movement. So we performed simulation exercises to share the concept and capacity building for ERU mobile clinic and pharmacy. The Syrian Arab Red Crescent has faced with high demand for essential medicines, including for chronic diseases. The concept of ERU pharmacist in the mobile team was shared and implemented to control the quality of medical care. Pharmacists can work with physicians to provide direct intervention in the management of patient chronic diseases, including the appropriate use of limited medicines and suggestions for alternatives and advice in pediatric dosages. Pharmacists could improve quality through prescription and dispensing audits. We also aimed to provide medical care in accordance with the WHO minimum standards for emergency medical teams, EMTs. So WHO classification of EMTs, type 1 is mobile and fixed clinic. So medical supplies to 50 to 100 outpatients per day for at least 14 days. Type 2, additionally, for inpatient medical supplies, such as surgical and anesthetics medicines. According to the clinical care technical standards in EMTs, both type 1 and type 2 required tetanus prophylaxis, which cold chain items, and chronic disease care by essential NCD medications. While the importation and transport arrangements for EEC were delayed, donations of EEC were received from WHO in Syria in preparation for the start of activities. WHO standard NCD kits and pediatrics kits, especially module number 2, are needed for these settings. to respond to the real needs, especially some months later of the earthquake. But those kits were not available for the prompt dispatch, so that not procured and only procured the EEC with some extra modules. For that reasons, some chronic disease NCD medicines and pediatric medicines, which are not included in the EEC, were also provided from the local Syrian Arab Red Crescent stocks. And tetanus prophylaxis medications such as tetanus vaccines and immunoglobulins are not held in the EEC standard list, so that we had decided to bring out from Japan with the pharmacies deployed from Japanese Red Cross. It was me. ERU cold chain equipment includes transport, emergency clinic ERU, and additional equipment for emergency health ERU, emergency hospital ERU. We have a variety of refrigerators and cold storage boxes for different purposes and utilization. The cold storage boxes for transportation for us, we use the vacuum-proof It can maintain temperature for up to 168 hours without electricity. We had experienced in transporting from Finland to Haiti before, and this time from Japan to Syria. Preconditioning of the cold storage material, its special liquid of ice pack, will be key for keeping ZDP for vaccine transportation. We have prepared 2 sets of ice packs and preconditioned by these 2 methods. The method number 2 seems very simple, but it was difficult to maintain the +3 degrees, ±0.5 degrees, for 3 days in the practical using hospital pharmacy fridge. So we choose the ice packs by visually checking that some part of it's liquid or not. We packed the vaccines in preconditioned ice packs at our hospital pharmacy and sealed them as baggage for my flight from Tokyo to Beirut. Then I had to stay in Lebanon for a few days to travel to Syria. But since we had no information about the cold chain situation in Syria, we decided to recondition them before leaving for Syria. The vaccines were placed in the refrigerator along with the data loggers, and the ice packs were reconditioned in the refrigerator and deep freezer for the next overland trip to Syria. We kept monitoring the temperature records by the data logger for the proof of quality. The temperature records of air transportation was very stable at 4 degrees Celsius for 3.5 days by using preconditioned ice packs at standard SOP. But at the base of operation site in Syria, we only had a household refrigerator in a hotel room, because household refrigerators are not stable enough to hold vaccines at temperatures ranging from 0 to 10 degrees. Only half of the ice packs could be stored in the fridge and freezer part in rotation every 2 to 3 days. Like this figure, we could keep the temperature between 2 to 8 degrees for 2 months. However, in my 3-month journey with the vaccines, only once I experienced the temporary temperature deviation failure during transportation from Lebanon to Syria by car. As you can see this figure, the temperature records showed at minus 1.2 degrees to 1.8 degrees for about 4 hours. These tetanus vaccines and globulins are tolerated at the hot site, but very harsh on the low temperature side. I conducted shake test to confirm quality against temporary temperature deviations during transportation. So we prepared a frozen sample as control vial and then shake together with the suspect test sample vial. After shaking the vials and out to rest to compare the sedimentation rate, as a result, we found the sediments in the suspect vials settle more slowly than the frozen sample, so that the suspect vaccines could be used. Actually, I had a hard time to preparing the frozen sample. It didn't freeze at around minus 10 degrees, even for 3 days, but frozen at minus 18 to minus 20 degrees for 2 days. Cold chain management of tetanus medicines is essential for EMT mobile clinic type 1 activities, but not supplied rapidly. So then we brought for the first time by hand carrying. Despite the hot and humid ambient temperatures at the site in Syria, where the electricity supply was unstable, we were able to continue to maintain and manage the product at a constant temperature. And coordinated donations with various stakeholders for effective utilization. Pre-approval producers were not followed, and the usual import documents were submitted at a later date, like GMP, COA, COO, COPP. Actually, it took almost 3 months to get from the Japanese medical manufacturers. The pre-approval is usually needed before entry, but was welcome and thanked. What was challenging as a medical logistician and a pharmacist for this ERU team was all the movement of medical supplies and processes different from normal ERU operations to collaborate with local national teams. The ERU pharmacy supply chain was secured, some varieties of medications with quantity required for immediate activities. Challenges were under this harsh environment and delay of importation of vehicles with refrigerators. We collaborated with local Red Cross medicines supply system for chronic medications and WHO Syria. Due to the poor storage environment and lack of experience of cold chain management, the local partner and our ERU team decided that not to store and use of cold chain items on the activity site. And all tetanus vaccines and globulins were donated to WHO Syria that has vaccination programs. Local pharmacists had performed well in the mobile medical team with professional skills at the first case in Syrian Arab Red Crescent medical teams. So the technical functions should be improved to have capacity of appropriate cold chain storage in a severe climate environment. In recent years, the use of vehicles as power sources has been promoted for the supply of medical supplies in times of disaster in Japan and internationally. Mobile pharmacy in disaster with refrigerator and electric machines to dispense medicines are becoming increasingly operational throughout Japan. In March 2021, Toyota Motor Corporation and others developed a vaccine cold storage and transport vehicles based on the Land Cruiser and obtained the world's first performance quality safety PQS certification for medical equipment from the WHO. So this vehicle is designed to charge the refrigerator from the batteries or an external power source even while the vehicle is parked. In addition to medical logistics, human resource development, technological innovations are required to maintain quality in harsh environments. Development and utilization of models for the use of externally powered vehicles in international disasters is expected. This is the part of our research project of the Disaster Management Research Institute established at the Japanese Red Cross. And as a member of this project, I would like to work towards for technological innovations in medical logistics in emergency response. Thank you for listening.
Thank you very much, Echo, for this very informative presentation. We do have a few minutes for questions. I don't know if there are questions in the audience. It's hard to see here with the light. Doesn't? Oh, Lucas? Okay. Maybe I'll give you. Is there another microphone? Okay.
Thank you very much, Eiko, for the presentation. I got curious about the car. So I saw from WHO that the Toyota got this PQS, which is an achievement. It's the only one who got this certification from WHO so far. Was this the one that you procured for Syria and did not arrive? No?
No.
Okay, that was my question. Thank you.
No other question. I do have a question for you, Eiko. You did mention that in Syria, the Red Cross was multinational. There was, I believe, the German Red Cross. You mentioned the Canadian Red Cross, the Japanese Red Cross. Did you work as one big team or smaller teams?
This time was a mobile activity, so our team member was very small, but each National Red Cross Society sent members.
Okay, so they each contributed to the larger team there. How did you find the collaboration between the various countries?
This time, our member was very experienced members, like we called the grandma team. So, it was very challenging mission, so we have to be very, very patient to wait for the response of the local societies, because they are not, they are very curious to work, to accept the international medical teams in the country, so.
Perfect. Thank you very much. Again, please help me with that. Thank you. Thank you, Eiko. So our next speaker is going to be Mark Kozoil. Mark is a pharmacist. Oh, I don't need this. So Mark is a pharmacist who, when newly qualified, established PPLS, a locum agency which prior to its sale in 2003 operated in 8 different countries. Mark was a founder of the Young Pharmacists Group in the UK in 1985. He was elected to the Royal Pharmaceutical Society Council in 1997. His close proximity to the peppermint water case, when a student and a newly qualified pharmacist were criminally prosecuted for making a dispensing error, which led to the death of a baby, prompted him to stand down from the Royal Pharmaceutical Society Council board from his role and establish the Pharmacists Defense Association in 2003. Today, with nearly 39,000 members, the PDA is the largest pharmacist membership association in the UK. As well as being the PDA chairman, Mark is currently the Secretary General of the Association of Employed Community Pharmacists of Europe. Please welcome Mark to the podium for this presentation.
Wow, ladies and gentlemen, I have to say I stand in awe of our last speaker. Isn't it amazing the roles that we pharmacists get involved in? That's really fantastic. It really is. My role here today is simply to ask us the question, because we can't all be like our last speaker. What is it that we as pharmacists working in our pharmacies in all of the different countries of the world can do to help out when a humanitarian crisis happens somewhere in the world? And what I'm here to tell you about is a journey that I've been on as a pharmacist, which involved me completely unexpectedly in the crisis that occurred in Ukraine last year. Yes, I am the chairman of the Pharmacists Defence Association, but I'm also the Secretary General of FIP. And what happened in March of 2022 is that FIP, that is an umbrella union organisation for member unions across the continent of Europe, was approached by its members in Ukraine, and they said, can you help us please? Our hospitals are being destroyed, our infrastructure is being destroyed, is there anything that you could do? Well, what could we do? I'd like to take you on a journey today to explain what it was that we did do, but I would like you to think, because we've got many leaders of many pharmacy organisations in countries all over the world, I'd like you to think about how you might be able to apply these principles to your country, to your continent, to situations that have either already occurred or may not have yet occurred, but may well occur going forward in the future. So what did we do as a bunch of pharmacists who, unlike our last speaker, don't work for the Red Cross? We've got normal jobs. How did we get involved in helping out the situation? Well, the first thing that we did is we needed to find out what was actually happening in Ukraine. That's an important part of the process. As scientists, we need to do an evaluation. We realised that the infrastructure was being destroyed. In the early days, it was hundreds. Now it's more than 1,000 hospitals have been destroyed in Ukraine. And when you get wartime injuries happening, medicines start to run out very quickly. Specialist hospital medicines start to run out very, very quickly. We wanted to find out how the situation was perceived by the public, and the feedback that we were getting from the whole continent and even the world was that members of the public were donating huge sums of money to the charities. Such was the level of concern about what happened in Ukraine. We needed to identify the problems. I actually went to the Polish-Ukrainian border to speak to people and meet with the Polish government, and this was a photograph from the border which showed that there was lots of members of the public that were sending cardboard boxes. And in those boxes, some of them contained trousers, some of them contained tents, baby milk, sandwiches, medicines. Sometimes the boxes would contain all of those things. Well, as pharmacists, we know that there's no chance that we would take any medicines out of boxes that we find at the side of the road, at the border, and give them to patients in hospitals. It just wouldn't happen. The situation was even worse than that. When we spoke to some hospitals in Ukraine, they told us that sometimes whole lorries would turn up, and the chief pharmacist in the hospital would be called because there was a delivery. They would go down to the car park to meet the driver, and they would say, well, who are you? Well, I'm the driver. Well, what's this? Well, this is medicines, I think. Well, where's it come from? Well, I'm just an agency driver. I picked it up in Frankfurt and I've driven it to Ukraine. Well, where's the way bill? Where's the documentation? Where's the quality cold chain? Well, I don't know anything. I'm just a driver. Well, unfortunately, that pharmacist couldn't receive those medicines into stock, and they were left out in the car park under plastic sheeting. These are the kinds of things that happen when there is a lack of pharmacist expertise in the process. So whilst there's lots of goodwill, lots of people contributing, sending boxes, what's actually happening, because the pharmacist expertise isn't being applied, there's huge waste. Because we all know that hospitals can only receive medicines that come through quality assured pathways. The medicines have to be delivered under optimum conditions. You can't have a lorry that's transporting chickens in the morning that's moving medicines in the afternoon. And they have to be delivered under a fully regulated system. As I've gone on this journey, I've learned that there are a lot of things that we know as pharmacists that people outside of our profession don't know, that they attach a huge amount of importance to, but we as pharmacists take that knowledge for granted. And that knowledge is extremely important in situations such as this. So we needed to establish some campaign objectives, and clearly at the top of that list was that we wanted to help those who desperately needed our help, the victims and the casualties of war. We wanted to create a message and persuade people to stop sending boxes, but actually to send money instead. And that money would enable pharmacists to use our pharmacy expertise to procure the medicines that would be needed, ensuring that everything was done properly under cold chain systems, fully regulated procurement processes. And then the other thing that we attached as our campaign objectives is we wanted to educate the public as to the specialist expertise possessed of pharmacists and the special nature of medicines not being normal items of commerce. And these were all of the things that we would hope to pick up in our campaign. We needed to generate substantial funds because the kind of medicines that were needed, specialist medicated dressings, highly sophisticated transfusion bags, painkillers, blood products, these are extremely, extremely expensive items. But we knew that the public was interested because the donations were huge. One thing that we realised, because we were a network of regional pharmacy organisations, was that within our grasp were very, very large numbers of community pharmacies where we could display posters in pharmacy windows right across the continent. We were very fortunate because although FU has 8 members, 2 of those members had specific expertise within their organisations. In my case, at the PDA, we've got a staff of over 70, we've got an IT department, we've got a legal department, we've got designers working there. We were very fortunate. The Polish union, ZZPF, their treasurer, had spent the last 20 years of his life in medicines procurement. So we had the basics of the capability of being able to launch a campaign. So the first thing that we had to do was to create a poster. An image had to be created by designers, and it was designed to appeal to somebody who was running to catch the bus in the morning. And you cast your eyes on that, you immediately get the message of what it's about. At the core is the pharmacist. It's a clean, tidy pharmacy, so there's structure, there's order, and it says what it does on the tin, medicines to Ukraine. Those members of the public who have more time can find out that pharmacists are working voluntarily, but there is a call to action. We're asking members of the public to send funds. We're giving them the ability to pay money with a QR code. And then finally, all of the pharmacy organisations across the continent are at the bottom of this poster. And the reason for that is because we needed the public to understand here was a very serious campaign, a secure campaign, well thought through. And that was an important part of the process. We needed to internationalise this. So if you were in Norway, you needed to be able to read the poster in Norwegian. These campaign posters are capable of being used in any single language. And then the important thing was when you clicked on the QR code, you went to one central coordinated website, which told a message, that what the crisis was. Don't send the boxes. Pharmacists are specialists, they can do the procurement, and medicines are not normal items of commerce, and the call to action is send money. In the top left-hand corner of the website, you can see the different languages that the same message is told in. So if you click the QR code in Norway, you'll read this message in Norwegian. The same for Croatia, Poland, etc. Working in this way enables any funds that are collected in the different countries to be pooled, to be centralised, which means it doesn't take an awfully long time before you can start to buy £250,000 lorry loads of important medicines, and you can get them across to the hospital authorities in Ukraine. We set up some architecture in the very, very early days, which we're really pleased that we did. No pharmacy organisation must ever handle any of the money. That was an important rule, because we knew that a campaign like this was probably going to catch the attention of the media, and they would be very pleased that pharmacy was doing something like this. But what we wouldn't want to happen is in a year's time, they say, well, what happened to the money? And the pharmacy organisations can't account for the money to the same standard as charities can, because we're not charities. So the rule that we established is every single pharmacy organisation have to sign up a local charity. The one that you see in the top right-hand corner there, that's a Polish charity that we went to. The one in the bottom right-hand corner is the one that we used in the UK. Now, the important thing is the charities are set up in a way they handle the financial governance. They have to account for the money. They are regulated by the government. And the key is that we need to find a well-known charity that we can work with, and we need to establish a formal written agreement, a memorandum of understanding with the local charity to make sure they ring-fence our money and they use it for purposes that we give them instructions to do it for. We started to talk to the charities and we started to learn more lessons along the way. The Polish charity that we went to, we told them we were going to put posters in pharmacy windows, said, is there any chance that we can please display your posters in our churches? Well, in Poland, there are almost as many churches as there are pharmacies. So that was a great piece of news for us because it meant the message could go out wider. We started to talk to other charities and we found something out that was a surprise to us. They told us that they always wanted to do this kind of work with medicines, but they decided not to because the subject was really, really difficult. It was complex. It was highly regulated. They'd rather leave it alone. They actually said, you guys sound as if you know what you're talking about. Well, why wouldn't we? We're pharmacists. This is what we do for a job. Yet again, we realised how much we take for granted the skills that we have. And other people appreciate those skills enormously, to the extent that one charity said, can you use some of our funds to procure medicines through your system? Well, we took the money straight away, we bought some blood products, and we sent them straight into Ukraine. So that was a really good story. Another important rule, you have to visit the crisis zone. Now, I'm in huge awe of our last speaker, who goes to crisis zones all of the time. I went to Ukraine once. Against the advice of my friends and family, I came back a changed man. The things I saw there, I will not be able to unsee. But nevertheless, it was a really, really vital and important thing to do because it taught us so much about how to make this scheme work that otherwise we'd have simply relied on us having to assume. That picture that you see at the top of that crowd, that was the team that we had to assemble to get us in there properly. There's a security team given to us by the Polish government. There was an anti-corruption squad that were given to us by the Ukrainian government. There was a translator. There was a film crew. And there's 2 pharmacists standing in the middle of all of that. All of those people were necessary to make this successful. We had to go to Ukraine because we needed to supervise the first consignment of medicines that we sent. It took about 3 weeks before the Ukrainian government would actually even talk to us. We couldn't work out why because we were trying to help. And then we realised that there's lots of people who are making big business out of allegedly helping out in crisis zones. And they're going around collecting money, collecting goods. And some of these never find their way to the intended destination. So watch out for the wise guys was a lesson that we learned. Because of all of the support that we had from the various authorities, we managed to get past a 23-mile tailback of lorries to get across the Ukrainian border with the medicines. We were way through customs in only 8.5 minutes. And then on one occasion, when we were doing some filming, because we took a film crew with us, the security officials from Ukraine suddenly stopped in the street and said, what are you filming? This is a martial law situation. But the anti-corruption officials that we were given were able to have a quiet word with them, and then they allowed us to carry on filming. They organised lots of visits for us with officials, which was extremely useful, and it was another part of our learning exercise. We visited lots of hospitals, and in the end we supervised the delivery of the medicines, and you can see that picture in the bottom left-hand corner. That's just part of the consignment, the first consignment that we took. We were astounded when we arrived there because they'd actually set up a TV crew to interview us when we got there. We hadn't expected that to happen at all. But actually, if you think about it, if the only thing they've got to show on the news every day is more missiles, more rockets, more problems, more concerns, our story is a very good story that helps the morale of the population. But it wasn't just the news channels from Ukraine that were interested. We ended up getting onto the national television programmes in several countries around Europe with the scheme that we had developed. And I'm just going to show you very quickly a couple of clips. We've got English subtitles for those of you who can't speak Ukrainian.
України були усі необхідні ліки. Закордонні фармацевти та благодійники об'єднались і створили ініціативу із забезпечення медикаментами. Нині вони відвідали Львівську дитячу лікарню Святого Миколая, що на вулиці Орлика. Обговорили з працівниками, чого зараз бракує найбільше у медзакладі. Згодом препарати закуплять за кордоном та передадуть на місця.
This next one
Do
is a
szpitala
Polish
Świętego
news
Mikołaja
channel.
w Lwowie
No
dotarł dziś
subtitles on this
polski
one.
transport z lekami. Potrzeby szpitala są ogromne, dlatego dary zostały przyjęte z dużą wdzięcznością. Transport został zorganizowany w
What we're talking
Zamościu, a
about is
pomogli
the
darczyńcy
specialist
z
skills
Wielkiej
that
Brytanii.
pharmacists possess.
Jesteśmy
The
tu, by
unique
zrobić
nature,
listę
the different nature of
najpotrzebniejszych
medicines
rzeczy
not
i
being normal items of
przetransportować je
commerce.
jak najszybciej na Ukrainę.
Pharmacists
Cała
across the
kampania Leki
continent
na Ukrainę jest
getting
potrzebna
together
i po to
to support the casualties of war. All of those key messages are getting across on those new channels. So my question really is, when was the last time that we can remember pharmacy getting on prime time national television with those kind of messages about what we do as a profession? What else did we learn? Well, we met with government officials there. That picture there in the top right-hand corner is in a military hospital, and those brown boxes are respirators. There were rows and rows and rows of these respirators. So I asked the clinical director, what are these respirators here for? Have the soldiers got a problem with breathing? He said, no, one of the countries sent us all of their leftover respirators after COVID. We don't need them, we won't use them, but nevertheless somebody is greenwashing their humanitarian credentials by sending us stuff they no longer need. So I asked them, well, what was it that the UK did? You know, I can ask this question because I'm from the UK. And they said, we were sent 2 of the largest lorries full of paracetamol that we'd ever seen with only 2 weeks of short-dated supply. We're now having to spend several weeks trying to figure out how we're going to destroy the paracetamol in an environmentally friendly way. What they told us was don't use the traditional push system that the West is normally very good at. We assume what they want and we just send it. Find out exactly what it is that's needed, get that procured and send that in. That's a far more efficient way of dealing with it. I remember talking to a president of a branch of Pharmacists Without Borders in Norway, and he told me that he'd gone to a country once for 6 months, but he had to come home after 2 months. And the reason was because he was spending entire days writing medicines in a book and then destroying them. And the reason for that was because those medicines had not been sent through properly and were simply being destroyed and wasted. So there's a big job there for us to try and get right. Now, what else did we learn? When you start to get involved in something like this, and you don't plan, it's not planned, this just happened to us, you get involved in lots of different interesting areas. There's lots of AMR programs at this FIP conference, for example, this week. The government officials told us they had huge problems with antimicrobial resistance in Ukraine, and they said, can you pharmacists help us with this? Do you think there's anything you can do? They even managed to get us a letter from the Minister of Health from Ukraine inviting us to meet with the Ukrainians to help them with their antimicrobial resistance issues. The reason why I've got that letter on the slide is I wanted to point something else out. You can see at the bottom and at the side there what are codes, barcodes, which I've tried to hide a little bit. The government is having to use barcoded letters to make sure that the letters that people are receiving are authentic, because there's so much fraudulent activity going on, and there's people running around with letters allegedly from a minister that's never come from a minister because they're just trying to get financial support from somebody. But we got asked to help in the area of antimicrobial resistance. That involved us in a huge project. I'm just going to ask my colleague Tasnim Khan very briefly to explain the very, very exciting developments that occurred next.
Thank you for that, Mark. Hi, everyone. So as Mark's already said, my name's Tasnim Khan. Where Mark has begun to describe some of the issues we were seeing, I'm going to talk to you a bit about the journey and how we understood the problem. So we decided that for a problem of this scale, it's really important to scope the landscape before we launched into solutions. Primarily, we partnered with the British Society for Antimicrobial Chemotherapy, where we decided collectively to conduct proper fact-finding. We then decided to hold a 2-day meeting in Lublin, Poland, because we thought that would be the most safe and secure option for everyone involved. And we also had other organizations on board, including the Commonwealth Association of Pharmacists, the Department of Health, the Ministry of Defence, and NHS England. We felt that it was really important to assemble the right group of people because we were very much aware that it was, and probably still is, the only opportunity that we have had to meet with our Ukrainian colleagues face to face. So we had to really make the most of it and be as productive as possible. So that's why we were really aiming to get top-level experts, but we also wanted to ensure that we invited the a range of people from Ukraine as well. So we had people from CDC level to local hospital level, and also from various different specialities and disciplines as well. As you can imagine, planning and preparing for such a meeting was essential. So we had to ensure that we were really organised. But I think what we learned quite quickly as well, that we had to be quite flexible and adaptable as well, because there were loads of things that kind of happened all the way up to the meeting. We had to be able to adapt as and when needed. So looking at the meeting itself, we had an expert chair who was kind of there to help lead the roundtable discussions and to help invite and encourage participation in the form of questions and sharing ideas and thoughts. We also ended up having the room set up in a very specific way. So as you can see from the image in the diagram, we had the Ukrainian delegates on one side with translators in between. We then had the UK delegation on the other side. And along the back, we had individuals such as Mark and myself, alongside a few others, acting as facilitators. So essentially, as facilitators, we kind of absorbed and noted all the information that was coming out of the room. And then we fed back directly to the chair with kind of prompts, further questions, and most importantly, summaries as well. The chair then fed this back to the room. And again, with the summaries, it was really important that everyone in the room was happy with the messages that were coming out. And we felt that this dynamic worked really well for this project. We also wanted to ensure that our Ukrainian colleagues had their voices heard. So we provided them individually with short snapshot surveys that they could complete at any point over the 2 days. We then provided the entire delegation with surveys post-conference as well, just because we wanted to make sure we were capturing any follow-up points, any ideas that maybe came out after the meeting, or anything that couldn't be kind of mentioned over the 2 days. So we really did want to maximize our opportunity. We wanted to make sure we got as much information as possible, but this then meant we had a whole lot of work to do to try and process all this information and manage all these notes. So naturally, the next step was to kind of work out how we could process and analyze this vast amount of information into condensed and usable chunks. So that's where we decided to do a form of informal thematic analysis, and we produced these mind maps. So this is just an example of one of the mind maps. I have had to take away a bit of the information for sensitivity purposes, but it's just to give you an idea of how we kind of condensed it down into themes. So after we did that, we would then go back to the survey responses and the notes, and we did a form of heat density mapping to show visually where the priorities were for Ukraine, where the UK group thought the priorities were, and where there was an overlap. So again, the feedback we got from this was that it was a really easy to digest form of condensing that vast amount of information. And again, when people looked at it, they were able to see quite clearly where the areas of focus were. So we had a few more mind maps that were similar to that. And then I'm going to very quickly kind of go through some of the solutions that we're looking at. So we're looking at a train the trainer program. We're also looking at a contained swabbing experiment. We're hoping to continue providing constant streams of expert advice. And we're also hoping to develop and launch a virtual portfolio platform. The common thread throughout all of these solutions is that we need to ensure we're engaging with behavioural change experts who can advise and guide us on how to best implement these solutions in a way that's culturally appropriate for Ukraine and best for Ukrainian people. So that's everything from me, and I'll hand over back to Mark.
Thank you, Tasneem. Can you imagine the feedback that I got a few weeks later from our Ukrainian colleagues was that the Health Minister of Ukraine had no idea that pharmacists could do this kind of thing. So these are the possibilities, these are the areas that we can get ourselves involved in. Government access was an excellent opportunity for us to talk to the government. We wanted to secure their support. The man on the right-hand side there is the First Minister of Wales. There are only 65 or so members of Parliament in Wales, and in one afternoon we saw more than half of them, and the theme that came back was we never realised that pharmacists could do all of these things. For those of you who keep up to date with UK politics, and sadly I'm one of those, that gentleman there, Sir Keir Starmer, is going to be Britain's next Prime Minister. Oops, did I really say that? Yeah. We've got a general election next year. We met with him when we went to Parliament, and I'll show you a quick video of what happened.
Mark, nice to see you. How are you doing?
Thank you so much for supporting us today.
No, it's really good. Such a good initiative.
Excellent.
Much needed.
Good.
Yeah.
At the moment, it's being supported by the public through donations on the QR code in pharmacy windows.
Fantastic.
So there's a bunch of pharmacy organisations right across the continent, because we've got this poster in all of the windows right across the continent in different languages. We're using our expertise as pharmacists to procure those medicines.
Fantastic. Yeah. I've got one here. So.
Got one there, even better.
Are we all in?
Yep.
So the next Prime Minister of the UK knows an awful lot more about what pharmacists can do. And I've just realised I have actually got a conflict, which I should have mentioned. I am actually a member of the Labour Party, but anyway, I've at least now established my credentials in that regard. Members of the public who come to donate are encouraged to leave behind comments. There's thousands of these. I've just pulled out a few there. There's some that I quite like here. Top left-hand corner, keep up the amazing work. I am in awe of the work you pharmacists are doing. If you're running a membership organisation of pharmacists, the comment on the right-hand corner is really good. As a member of the PDA, I am proud to support this initiative. But my favourite is the bottom left-hand corner. Get the medicines properly, please. Thank you. That was somebody who didn't know that there was such a thing as getting medicines properly. They know now. We've taught them about medicines. We've taught them about what pharmacists can do. So this campaign is also very good for raising the profile of pharmacy. We've encouraged leadership amongst the pharmacy student ranks. We ran a competition for them to see what they could do. I'm going to show you just a very, very quick video of Portsmouth School of Pharmacy who actually won the competition, and I'll tell you what the prize was in a minute as well. Short. For those of us who are running pharmacy organisations around the world, the possibilities with this, especially in encouraging the youth. The prize that our student who won this was that Ramisha, who's sitting in this room, won a ticket to join the PDA delegation to the FIP Annual Congress in Brisbane. So that was a memorable experience, I'm sure, for her. And she has already told me she's really thrilled by the welcome that she's received from many of you. This has been a lifetime opportunity. So what makes this scheme work? We've now had a chance to dissemble it into small parts. We do that, don't we, as pharmacists? We need to understand how things work. And it's actually a triangle, but at the very, very heart of it needs to be a humanitarian crisis. Next to that needs to be the pharmacist expertise that can be deployed. But frankly, none of that will work unless there is a wrapper around that, which is what we all inherently have as healthcare professionals. We care about people and we want to help. It doesn't matter whether we're working in our community pharmacy and the patients are walking through the door, or whether we're in a hospital and our patients are on a ward. We want to be able to help people who might be halfway around the world if we possibly can. The structure that we've created is made up of 3 sections, the first of which is the central coordinating organisation. Can you remember at the start I told you it was the PDA and ZZPF? Well, what we have is a situation that is unsustainable. It can't be PDA and ZZPF running these campaigns, particularly if we now start thinking about what happens about a crisis in Africa or Indonesia. So we have now set up a Pharmacists Without Borders charity in the UK, the idea being that we will have trustees from all around the world joining forces and taking it forward. It produces the legal agreements, designs the website, designs the posters, makes those posters available to local national pharmacy organisations. The role of the National Pharmacy Organisation: find a local trusted charity partner, get them to sign the MOU, distribute the campaign posters around all the pharmacies in the country, and if you want to get behind the campaign in your country with media, with politicians, you can do that. The final part is the role of the regulated charity, because no pharmacy organisation must touch a penny of the money. Receiving and holding the funds, ring-fencing the funds, releasing the funds when told to, and keeping and accounting for all of the funds for transparency purposes. If you repeat this on a regional basis, you can generate lots of funds. That happens to be a map of Europe. It could be a map of Africa. It could be a map of South America. It could be a map of any region in the world. So we've pretty much come to the last lesson here. You've got to establish the arrangements in advance. What we found in Europe was that the countries that had charities already established way before were hugely able to raise enormous funds. One country raised 1.9 million euros because they'd been established for 15 years. They were very well known. They were highly, had a big profile. One small country set up a charity just before the crisis in Ukraine. It was in the right place at the right time. Its shop had opened and it generated 950,000 euros in just 3 months. Whereas 5 countries that had no charity in place but just started the campaign sometime later raised 395,000. In the UK, we've raised £235,000. We didn't launch our campaign until July, And what that tells you is you need to be in a position to start as soon as the crisis happens, because that's where the public interest is at its highest. Once you get into that space, you start to get approached by people. When the earthquake happened in Syria and Turkey, we managed to raise £10,000, even though we weren't trying to, from our members, because they said, you do the humanitarian stuff, don't you? So we managed to send that money to the FIP Foundation. We've already received some interest from our members about what's happened in Morocco and what's happened in Libya. You'll get contributions from places that you least expect. I'm very, very pleased to be able to announce Pharmaceutical Defence Limited from Australia sent us a significant 5-figure Australian dollar contribution from halfway around the world on behalf of its members. And I've already assured Gilbert that that was spent on blood products that went straight into Ukraine very soon after we received it. So finally, we've learned about the what and the how. Why would we want to do something? Well, this is quite a big slide, but it doesn't need a big answer. The reason why we want to do this is because it's a no-brainer. It's a classic win-win. The humanitarian casualties win, we win, everybody wins. We all get an opportunity to participate in supporting humanitarian crisis halfway around the world without even having to leave our own countries. Now, I came to Seville last year with a very similar presentation, and I really hoped in my heart that FIP would take up the challenge of taking this initiative to further parts of the world. Now, there are 3 types of organisation. We all know who they are. Those that make things happen, those that watch while others make things happen, and those that say, what happened? Well, I can tell you, I turned up to the council meeting of FIP on Sunday, and by unanimous vote, the FIP Council agreed that they would recognise this as a partnership programme. They would review the progress over the next 12 months, and they would see how they could support this programme going forward. I can't tell you how thrilled I am with that, because now everybody from all around the world in pharmacy organisations everywhere can figure out how you can participate in something like this. I expect it will happen through the regional forums. And the great news is today we have the first country in Africa, South Africa, signing a memorandum of understanding. And this programme, which started off as Medicines to Ukraine, is now going to be a platform that we will build in Africa, and we will come to other continents as well in due course, because we want this to be around in 10 years' time, in 50 years' time. So finally, I never had the honour of meeting Dominic Jourdain, because we only joined FIP in November of last year, but it was such a moving video that Catherine was in and that Ali created that we saw at the opening ceremony. And I could see that his legacy still ripples through the organisation. And his mantra was trust, solidarity and action. And I can only imagine that with something like what I've been talking about here, the amounts of trust that we will generate in the eyes of the public with NGOs and with governments around the world will be enormous. To make this succeed, pharmacy organisations have to collaborate, they have to work in solidarity. And working together in this way, we can definitely deliver action. We won't be able to launch this all over the world next month. The road will sometimes be windy and it will be rocky, but I can promise you at some stage going forward, and now with the support of FIP, somebody from this organisation, if you will be talking to a pharmacy in your organisation in your country about joining the Medicines 2 campaign very soon. Thanks very much for your attention.
Now you can take a breath. We are running slightly on time, exactly, so we won't put questions at this stage. If there is time after our next presentation, we will have questions then. All right, just one question.
Okay.
Yeah.
Yeah, can you hear me? Thank
Yes.
you. Thank you for fantastic presentations. And I have to say this is a fantastic development of how actually pharmacists can contribute in crisis situations. And it's advocacy about the profession, it's saving lives. But I was very touched by your last slide and thinking of our beloved Dominic Jourdain, working in trust, solidarity, in action. He would have been extremely proud being here today to see and hear and listen to your presentation and the last slides. Thank you so very much.
Right, well, today we've had the pleasure of listening, as we would say in military terms, to somebody from the tactical level. We've had a provider and person who works on the ground in the delivery of the healthcare. We then had a presentation, thank you, Mark, from someone who works at the organisational level, so the actual next step up, who has that overview and ability to provide at that level. We are now going to have a presentation from what we would call the strategic level. FIP has that role, and it is a great pleasure to be able to introduce our next speaker. This is Ruben Viegas, who is the FIP Practice Development Projects Coordinator. He is a pharmacist from Portugal with a master's degree in exercise and health from the Faculty of Human Kinetics in Lisbon. He is currently enrolled in a PhD program focusing on the promotion of physical activity through pharmacists. He has been involved in different associations and educational activities focusing on the area of public health and pharmacy practice. Ruben.
Thank you, Jane. Good morning, everyone. I think my job is a bit hard because the previous two presentations were great, but I'll do my best. My name is Ruben Viegas. I work for FIP. I have no conflict of interest. And as you heard from Jane, I'm doing a PhD in physical activity promotion. So if you didn't do your stretch today or your active break, now is the moment. And I also have a slide from this morning from the FIP Fun Run. We had almost 100 people running at 7 a.m. And this is a very nice initiative for you to consider next year because the money that we collect will go to the FIP Foundation that then is working in also this humanitarian causes. And also on the right side, you can see some of our volunteers. So if you see someone on a green shirt today, just go there, say a word, say hi. Maybe a round of applause for all volunteers working in this Congress. Yes, that's perfect. Because volunteering is also on the essence of the humanitarian spirit, right? I bring you here just a couple of notes because you might think, yeah, I'm not humanitarian pharmacist, what can I do? Other people are doing that, right? So I don't need to do anything. But humanitarian, by this definition, is concerned with or seeking to promote human welfare, right? And we, as pharmacists, we are doing that in a daily basis. So you can start really small. You can go to your local association. You can collaborate with a charity. You don't need to immediately go to a war zone. So you can start really small, but engage in this humanitarian spirit. And we have already WHO and the United Nations doing a lot of work in this area. So FIP really wants to collaborate and follow these lines of humanitarian work. And on the left side, you have a note that, of course, all the disaster and emergency situations can be different. They can be natural, they can be man-made, they can be war. Also had a pandemic in the last years. So these are here and probably will have much more in the future. So there's a role for us now, there was. FIP has been doing this for a lot of years. And there's a role for us in the future because all these disasters and emergency situations will still happen in the future. And I brought a summary of the WHO health emergency appeals from 2023. And you can see that 339 million people are facing humanitarian needs. So this is quite a big number, and we need to consider this also as a priority. And on the other side, you have all the countries. And it's quite an extensive list. So as FIP, we want, as Catherine said yesterday, we are the teapot that brings everything together. We're also the table for conversation. So we need the members also to engage and come to FIP and say, we have a disaster situation, we have this ongoing. Because it's not only the moment the disaster occurs, it's also the next years, the next months, next years, that it's still in the recovery phase. And of course, I could not leave the FIP development goals out of humanitarian because humanitarian really links to all of FIP development goals. We highlighted number 18 because 18 is access to medicines, devices, and services, and this is one of the main areas that we found through our conversations with the member organizations that supply chain is a big issue in this situation. So we want to make sure that pharmacists are part of ensuring the access to medicines and services in these situations. But we have other issues like patient safety, like other speakers said, like we will not pick up a box and give to patients, right? So we need to ensure the medicine's quality, we need to ensure that the treatment is correct, and we need to ensure that as a pharmacist we are doing our job. But one of not the highlighted ones, for example, 17, antimicrobial, is also important because in these places antimicrobial resistance can grow, so we can really link to multiple development goals. And again, I could also not mention the FIP military and emergency pharmacy section. You might see some people in their uniforms walking around, but you can also see other people in civil wear. I invite you to talk to them, ask them what they're doing in their jobs, in their professions. And MAPS has been with FIP for a while, has been working in this area for a long time. And now under the supervision of Sylvain, or the leadership of Sylvain, they're doing also a great job. So you can also check the FIP website to learn a bit more about this section. And on the bottom side, you have also an article that will be published in the future about the role of FIP in the support to Ukraine. And you can see that Sylvain also took leadership in that publication. So again, how can we help as pharmacists? So as Eiko mentioned, we're also part of a multidisciplinary team, so we will not go alone and do our job alone. We are part of a team. We need to engage in those teams. We can bring our expertise in medicines to those teams and help ensure that we're doing the right for the patients in those settings. Again, the donation, the supply and the management, we saw some supplies. For example, imagine during the pandemic, having to bring vaccines that need a cold chain. Some other professions might not be as aware as a pharmacist that had training on this area to support the delivery and the safety of these vaccines. So again, supply chain is one of the key roles, but not only. And then also awareness and training. We saw also that one of the solutions that Mark presented was also train the trainer. So this might be one of the ideas or solutions that FIP supports the development of training competencies that then are delivered at the national level and then bridged to the local level. So basically, Mark asked what can the organizations do for the members, and what to do is, what can FIP do to support the members, to support the pharmacists on the team? So it's, we're basically working all for the same goal. Another important aspect that we're looking into is also the gender issues in the humanitarian settings. So there's been a sharp rise in need for humanitarian aid for example, during the pandemic or also during the climate change that is happening and impacting all of us daily. And we have that this crisis can be disproportionate in affecting women or girls in the impact of healthcare, education, or gender-based violence. So this can be amplified in these settings, unfortunately. So these partnerships and this support to the field can also help this type of situations. So I just put an article there that you might want to read, is why do we need more female voices while addressing humanitarian crisis? Because this is also a big piece of work for FIP. We have the FIP-wise, Women in Science, but you also have all the program in equity that we're developing. So this is an important issue that also needs to be addressed and can be linked to the humanitarian. And last year in Seville, we launched a commitment. So as FIP, we said, we need to do something, we will do something, we commit to do something. And you can see the commitment on the screen. And this is basically the baseline that we're going to follow in the next years as well. Already revealing my last slides. But this is what FIP is committed to do. So support the pharmacy associations and the skills for this type of situations. Liaise also with national ministries of health, so FIP can provide letters of support, can provide good practices, can provide all this documentation that can then be used to link with the national ministries and other stakeholders that might be involved at the national level. We can also help create visibility through our social media, through our channels, through our campaigns. This is also very important, and Mark also showed that in the videos that he presented in the news. Sharing good practices and success stories, because not all the countries might be ready for all the disasters, but if a country had recently an earthquake, for example, they can take these good lessons and have a preparedness for these kind of situations in the future. Then we also want to engage stakeholders to strengthen humanitarian work, also support the members to engage at the national level, and finally to promote also interprofessional collaboration. Again, we're not working in these teams alone, so we need to also know if we can have multi-professional, interprofessional collaboration in these humanitarian settings. And another piece of work that I wanted to share with you is the pandemic preparedness, response, and recovery that was highlighted during the pandemic. All these resources we have available, and this is an example. If we have an emergency situation, we can respond, we can produce the materials, we can then make them available for the FIP member organizations to disseminate into their local members. And again, this information is available on the FIP website, and all these publications, you can check them there. A big important piece of work, and I just recently learned that EICO was very involved in this piece of work, so thank you very much to all the authors of this global competency framework. So this is one of the first steps to recognize that there's a need to map and understand the competencies that pharmacists need in humanitarian and disaster and emergency situations. Because even if I told you, you should go and engage in your local associations, there are some skills that are needed and some skills that are relevant when you do this type of work. So you can see on the summary, you have different groups of competencies, and then they're all listed in the document. And this one is available in Turkish and Arabic, and we are also working in other translations, because translations are also an important factor for access for the FIP members. And I invite you to take a look at the framework, because it's a very, very interesting piece of work. And since Seville, we have intensified our support to countries, because this goes in line with the FIP vision, of course, to have a world where everyone benefits from access to safe, effective, and quality and affordable medicines. So we need to be closer to the members and understand what their needs are to make this vision true. As well, we have very clear that we condemn all acts of violence or war that cause suffering. So this is also in line with our humanitarian work. And we just rectified or just launched the statement of policy for the role of pharmacists in disaster and emergency situations in this Congress. So this just brings a new importance to this area. And thank you very much for Ina and Sylvain also for their leadership in this piece. And this is an important, because you can take this statement of policy, for example, and you can bring them to your local ministries, to your national health authorities, and you can say, okay, this is a global relevant topic. Can we do something more in this area? So again, FIP is providing these resources, these important tools that can translate into actions next to the stakeholders in your country. So I'll just list some of the colleagues we contacted and conducted some calls and some actions. One of them was, of course, the Ukraine. We had also our colleague Lucas that was on the field, and he also shared quite some nice insights and feedback on how is it to be really there, because he was, for example, the other day he was explaining to me what is it to be there on the field, because I cannot say the same. I've never been in the field, so it's also very nice to have this understanding of what is it to be really there on the situation. So FIP produced some resources, some tables of equivalence, for example, for some molecules, and all this work was done with the All Ukrainian Pharmacists Chamber and our colleague Oleg, that we'll see again next on the video that we have as well. So another situation that recently happened was the earthquake in Turkey and Syria. We also contacted the member association in Turkey, trying to also understand their needs and how can FIP help. Because again, FIP is not in there, so it's more a collaborative approach. It's more how can we support the members to get the resources to the field. Recently, we also contacted colleagues from Sudan. They are also facing some difficult situations over there. The cyclone Freddy affected the African countries, so in Malawi, Mozambique, Madagascar. We also had a call with the colleagues from Malawi to understand what can be done regarding the situation. And again, it's not only, I think the cyclone was around February or March, but it's not only during those months that the members might need support, it's also the months afterwards and what follows, because some of the damage is not repaired immediately, and it takes maybe months or years even to to get it back. Other colleagues we are contacting were also the colleagues in Slovenia that's had severe floods during this summer, and also recently the colleagues in Morocco that also suffered the earthquake. This is not an extensive list. We need also, as I said before, we need you to let us know if there are more cases, more countries, more needs, so we can also reach the countries accordingly. And more recent even was the case in Libya, also with some severe floods, and we contacted our colleagues in Libya to understand what FIP can do. All this information and everything I was presenting till now is in our Humanitarian webpage. So it's a separate webpage that gathers all the resources for the ones that are interested in this area. And you can see all the activities, all the materials, all the partnerships that we're still building and we want to increase in the next years. They will be all featured in this webpage. And almost finishing, but I wanted to launch this video message today with all of you. So you have a premiere, it's okay, of the video. So we asked the colleagues to say this sentence on the screen. Pharmacists play a vital role in disaster and emergencies, building trust, fostering solidarity, and acting proactively. Let us all stand shoulder to shoulder and support each other around the world. But if all said in English, it would be boring, right? So we have colleagues from all around the world saying this in different languages. And this is one of the awareness pieces and one of the important messages that we want to highlight as FIP. And yeah, I'll leave you a couple of minutes to look at this masterpiece. There's the click. Yeah. Thank you.
Фармацевти відіграють життєво важливу роль під час катастроф та надзвичайних ситуацій, будуючи довіру, зміцнюючи солідарність та діючи на упередженість. Давайте стояти пліч-опліч і підтримувати один одного у всьому світі.
يلعب الصيادلة دورا حيويا في الكوارث وحالات الطوارئ من خلال بناء الثقة وتعزيز التضامن والعمل بشكل استباقي. دعونا نقف جنبا إلى جنب وندعم بعضنا البعض في جميع أنحاء العالم.
Os farmacêuticos desempenham um papel vital em situações de catástrofe e emergência, criando confiança, promovendo a solidariedade e agindo de forma proativa. Ficaremos lado a lado e apoiaremos colegas em todo o mundo.
Les pharmaciens jouent un rôle essentiel dans les catastrophes et les situations d'urgence en instaurant la confiance, en encourageant la solidarité et en agissant de manière proactive. Soyons solidaires et soutenons-nous les uns les autres dans le monde entier.
药师在灾难和紧急情况下发挥着至关重要的作用，他们建立信任，促进团结，积极主动地采取行动。让我们一起并肩作战，在世界各地相互支持。
Farmasi kui duwe peranan sing penting banget loh. Waktu ni ono berlakunya musibah, apa kecemasan, yo enggo membangun ke keyakinan, mantep ke perpaduan, karo gawe tindakan sing proaktif.
私は災害や緊急時に重要な役割を果たします。信頼を築き、連帯感を育み、積極的に行動します。
みんなで肩を組み、世界中で支え合いましょう。
Thank you so much, everyone. I think this is an important piece because English might not be the first language across the world and for many of you. So FIP is also understanding this need and understand that your language is also important to engage in the humanitarian and all the relevant work for FIP. So reaching the end of my presentation, as I said before, what FIP will do in the future and focusing on the commitment that we did in Seville. So again, is strengthen the need for more training following on the competency framework that we have Again, not providing the training directly, maybe through the provision and partnerships program that we have at FIP, and collaborating with the member associations on the provision of these skills and these trainings, so pharmacists can feel more confident and more eager to go and support humanitarian causes. Also increase collaboration with other organizations, like I said before, the United Nations, WHO are already doing a lot, but also other organizations that are already in the field. So we don't want to reinvent the wheel, we really want to collaborate and work together with everyone in this program. Again, create visibility, similar to what we're doing with this video that will also be launched on social media. So create visibility of the role of the pharmacists on this field, because it might not be obvious for everyone that pharmacists can have a role in this area. And finally, one of most important, of course, is share across FIP member organizations good practices, being the teapot, being the table up where people can talk and discuss ideas and can be also prepared for future disasters and emergency situations. And one of the examples is what Mark already presented, so the Medicines to Somewhere campaign. So we want to support the access to medicines everywhere, so we want to support the role of pharmacists in these campaigns across the globe. So we had already the initiative Medicines for Africa, for example, that FIP is supporting. So we want to do this with all the member organizations that are interested in supporting this type of initiatives. And again, and as Lars said before, I think we cannot forget the three big words. I really agree that Dominique would be super happy to be here and listen to this presentation and listen to development of this program. So, and these are also the words that are in the video, because we want to keep Dominique's legacy and we want to make sure that these are almost the FIP motto. So trust, solidarity, action is the main message that I want to end my presentation. And if you have any questions, you can write to my email, or you can check the Humanitarian webpage, and you can also find the contact details there. So I think that would be it. It's World Pharmacist Week. Thank you.
Thank you, Ruben, not only for this presentation, but for all the work you do with FIP on the humanitarian program. I think there's a lot of work that still needs to be done, but at least FIP is in the right direction moving forward. Thank you for this. Now, we do have about 5 minutes for questions. I know that we did not have a chance to have questions for the previous presentation for Rubens, but also if you have questions for ECHO. So if you do have questions, please indicate to which speaker the question is directed to, and then we'll go with this. So I see a question here, and then we'll see over there after that. Yeah.
Hello, thank you for the presentation. So my name is Barbara. I'm a humanitarian pharmacist. I currently work in Ukraine. And it's delightful actually to see FIP getting more engaged in the humanitarian work. So my question will go, well, to Ruben, but FIP in general. Just to give you a little bit of my background, you can, a spoiler from tomorrow's presentation, I'm presenting on women's role in humanitarian work. So if you want to know more, please come. But not regular part of pharmacist's job, but my role has expanded in humanitarian work beyond pharmacy quite a bit, and it means that I have been responsible at times for negotiating access, safety and security, and a lot of different elements related to safety. And I don't know if everyone's aware, but for a humanitarian, it's very important for us normally to be disassociated with the military, even though in FIP we do quite understand why disassociation is made. It's very logical that we work in the same type of context, the same type of challenge, and I find our conversations with our military colleagues very fruitful and interesting, but it's also from us at a field level an issue of safety. So being associated with the military can make us quite unsafe. I have my phone searched and my personal information researched quite a number of times. I have negotiated with armed groups and they asked to see my information, and for them to see us associated with the military can be difficult and can lead to a situation of kidnapping and things that we don't want to see. So it's just to out of interest to see what FIP thinks to do in this regard. I think there's a lot of colleagues that work in humanitarian work and that might be more engaged with FIP if this association wasn't there. So I don't know if there's any plan in this regard already.
Thank you so much, Barbara. It's a very important issue that you're bringing up, the safety also of the pharmacists on the field. The military emergency pharmacy section comes from a while ago, so it brings all this historical perspective also, and we want to make sure that we can have everyone that works in this type of settings together. If then there is further discussion inside the section, I think it can be very healthy to bring the colleagues into the session and discuss among the group what are the issues and what can be the solutions. So then we can also assess at FIP level what if there are other solutions that can be made. Yeah, thank you.
Catherine, you had a question?
Silvana tried to take that microphone in my handbag just then, which would be very dangerous for everybody. So I just wanted to make a couple of observations and a call, really, to the room. The point that humanitarian, the word itself has human in the middle, really, really comes home to us when we realize that even some of our team at FIP live in the countries where these disasters have happened. They've had families and colleagues who have been impacted to a dreadful degree. And it's about time that we all understand we can be part of the disaster as well as being part of the solution. And I think I loved your phrase, Mark. We've really got to be moving from onlookers to part of the solution. And I would say any questions anybody has about what FIP needs to do, look at our commitment, our policy statement, and then tell us what you need. This is not about FIP providing a list of things that we think you need. This is about us responding to you in a human way. Could I also just take a moment, Sylvain, and say so much thank you to my team. I'm super proud Ruben's there, but also Noor is fundamental to this work, as is Marwan, who is now moving on from FIP, but the entire FIP team stands shoulder to shoulder in this work with our member organizations, with our individual members, with our communities and our families, but also as a team. I'm really proud of you, Ruben. Well done.
Thank you, Catherine. Any other questions or comments for our speakers? Yeah, Petra?
I'm going to follow the trend and be annoying and have a statement before my question. I think it's a good opportunity. We've talked a lot about donations today, and to just suggest that everyone goes and reads the WHO guidelines on donations for medicines, and they also have a guideline for donation for medical equipment. And it's something that we should all be familiar with, abide by, and encourage everyone else to abide by as well. And again, as we were just saying, humanitarianism is about humans. It's not necessarily about people in the field, and we all have an opportunity every day to engage and to support humanitarian work. And it's beyond medicines. You can't take tablets if you've got no safety, you've got no house, you've got no water, you've got no food. So if you can, find a charity that resonates with you, that does what you believe and works in the way you want, and make regular donations to them, because it makes the world of difference. So on to my question. My question is actually to the whole panel. I think those of us working in the humanitarian sector completely understand the role of pharmacists, and they're important. We have so much evidence of the importance of pharmacy and the difference that having pharmacists makes in the community and within the hospital sector. So what advice would you give in terms of how do we build that evidence base for the humanitarian sector, and how do we advocate for the inclusion of more pharmacists within NGOs and within the way that we work?
So I bow to experts, obviously, in the audience, but I think part of the answer is what we've been doing today. What FIP has already committed to is to raise the awareness in the eyes of the public, with governments, everywhere we go, as to the value of pharmacy enabling the very good work that you do, enabling the work that others in healthcare do. But actually, I think there's also another component, which we've talked about, which is getting pharmacists who aren't directly involved at the coalface, supporting, as you've quite rightly said, making those regular donations, connecting with those charities. I don't think there's one single answer, but it's the whole thing that we've got to keep the show on the road. We've got to keep on moving on. And the commitment that FIP has made now to the humanitarian area, I think is a really, really fantastic step forward for FIP and for all of us.
Thank you, Mark. So we're at time. I'd like to thank all the speakers today for the very interesting presentation. As it was mentioned earlier, we've got all the levels from the people that are supporting the patients directly, how pharmacists can help those pharmacists working, and also how a pharmacist organization like FIP can help everyone. So again, I'd like to thank all the speakers, and please join me in thanking them as well.